recanalization, kissing balloon after the stent implantation on the level of the new carina that we are formatting with the stents. And this is the final result showing recanalization both on the aortic, aortoiliac and femoral level with excellent result on the CT that was performed 6 months after the procedure with a very good clinical result. The second case is even more dramatic. It's a young lady, 49 years old, with a family history of atherosclerosis and multiple risk factors, again with a very low ankle brachial index, about 0.4, with very high, just below the renal arteries, occlusion of the aorta. And you see that that is again a very not very good collateralization toward the common femoral artery. Because of that, the lady was so symptomatic. In this case, we have used a femoral and brachial approach with the so-called rendezvous technique. The advice is to meet the wires from above and from below on the level of the dissection, not on the level of the open arteries. So in some cases, we need to snare the wire and to make true maneuver in order to have better support and to go with the balloons easier. And so this is again a long balloon predilation of the level of the iliac and the level of the aorta. This is the result after stenting with nitinol protege implantation of stents on the aorta and also into the iliac arteries. And this is the result showing excellent flow restoration on the level of the aorta. You see how good is the flow. And the ankle brachial index increased practically to normal on both sides, and the lady is absolutely asymptomatic now, approximately 1 year after the procedure. As several tips and tricks I mentioned already: double upper radial or brachial and lower femoral or popliteal vascular access is useful. Rendezvous technique and wire sharing is also useful. After crossing with hydrophilic wire, sometimes we need stiffer wire, more supportive wire, in order to facilitate balloon crossing. Also facilitating balloon crossing is the true technique. So to externalize the long wire from the brachial, to externalize it from the femoral, and to make the tension on the wire in order to facilitate the balloon crossing. Inflated balloon within the stump and using the wire within the inflated balloon is facilitating to stay intraluminally. And in some cases of subintimal tracking, it's not